Hi everybody, Andrea Turowski here. I've been tutoring dental hygiene and dental assisting students since 2005. So actually since I was 19 years old, if you want to get down to it. And mock exam practice questions are what students always ask for, and it's truly the best way to test your knowledge on a certain topic, right? So in the video today, I want to go over the tooth case study practice. So this is where we're talking about tooth surfaces and basic anatomy of the tooth. Think dentin, enamel, and pulp. So I'm just going to jump right into it, and let's go right into some case study practice questions. So I'm actually going to skip down here. This is one of the PowerPoints that I have inside my course, the VIP Board Exam Prep Academy, where every week we go through different topics, and the tooth is one of the topics. So I just kind of skipped through. Let's just jump right into it. So are you guys ready? Okay, so I'm going to read the question out to you. A patient presents with severe tooth pain in the lower incisor. On examination, you notice a large cavity that has reached the innermost part of the tooth. Which part of the tooth is affected, and what treatment approach would you recommend? So think about it for a second. Feel free to pause the video if you want to. So while you're thinking about it, I'm going to explain it a little bit as well. So anytime you're going over a mock exam question, what I want you guys to think is, look at different parts of the question. So the patient presents with severe tooth pain where? In their lower incisor. You notice a large cavity on the innermost part of the tooth. What does innermost mean? Is that the inside or is that the outside? And then which part of the tooth is affected? And depending on what part of the tooth, what treatment approach would you recommend? Okay, so let's just go through it right now and I will explain it to you. So the pulp is the correct answer, okay? Because we're looking at the lower incisor. There's a large cavity. Inside the tooth is going to be the pulp. Inside the tooth could also be the dentin if you think about it, right? So that would have been a possible correct answer as well. But the innermost, I would say, is kind of the key word here. What is inside everything? It's going to be the pulp, which is the nerve. So I have even included the rationale here for you. So the pulp is the innermost part of the tooth that contains nerves and blood vessels. Severe tooth pain indicates involvement of the pulp. This is true. If you're having pain, it doesn't always mean you're going to have pain, of course, with an issue. But when you do have pain, this is when, as dental professionals, we kind of go, uh-oh, we got to take an x-ray and figure things out because the nerve could be affected. So the recommended treatment would likely involve a root canal to remove the infected or inflamed pulp and alleviate pain. So, of course, a root canal wasn't part of the answer, but I kind of wanted you guys to think about that other part as well. So sorry, I'm going to go back to the slide here. It says the last part, which part of the tooth is effective and what treatment approach would you recommend? So whatever you picked, then you would have to think, okay, how would I treat the pulp? Or how would I treat the dentin? How would I treat the enamel? How would I treat the cementum? The pulp is the innermost part. How do we treat that? With a root canal, which is everybody's fear, but that's how we treat it, right? Okay, so let's go through another question here for you. A patient presents with receding gums and exposed tooth roots. On examination, you observe a yellowish hard tissue covering the root surfaces. Which part of this tooth is affected and what treatment approach would you recommend? So this is another question where it's kind of a two-part, but you only really have to answer the first part. Whoops, sorry, I just gave you guys the answer. Sorry, I didn't mean to do that. So I don't know if you saw that, but I'm going to pretend you didn't see that. So let's look at the question here. Receding gums. When that happens, there's exposed root surfaces. What is that? Okay, the root is always covered by what? Okay, this is the yellow part of the hard tissue covering the root surface. And then you have to think, well, how would we fix that? So since you guys probably saw the answer, I'm just going to go right into it here. So the answer is cementum. This is what's always covering the root surface. Cementum is a layer of hard tissue that covers the root surfaces of the teeth. Receding gums and exposed tooth roots indicate the loss of protective cementum. The recommended treatment approach would involve addressing the underlying cause of gum recession, such as improving oral hygiene practices and potentially applying desensitizing agents or performing dental bonding to protect the exposed cementum. So all of that is a lot, right? But think, if you have receding gums, the tooth root is showing, what do? First of all, you're going to determine what happened. Why did receding gums happen? Okay, why does the patient have receding gums? It could be from brushing too hard. So you don't want them to continue brushing too hard to make the receding gums worse. You want to help them. Even if they're not in pain now, I don't believe the question says they were in pain. I'm just kind of reading it over myself here. No, so it doesn't say they're in pain. It's just showing you what the patient presents as. But if they continue brushing too hard, they might eventually, that tooth might become more and more sensitive because the gums are receded and the tooth root surface is showing. If the patient is still brushing too hard. But if the patient is in pain and desensitizing toothpaste doesn't work, such as Sensodyne or any toothpaste that is meant to help sensitive teeth with the ingredient potassium nitrate, then we would apply a desensitizer onto that area at the dental office. And that's what they go over towards the last part. It says you could potentially apply desensitizing agents or performing dental bonding to protect the exposed cementum. So did you know you could also apply a bonding solution to that exposed root surface to cover it up? You could even apply composite, a filling material, over it to cover it up as well. So you have many different options, but the easiest thing to do first is to bring it to the patient's attention. They might not realize their tooth root is showing. They might just think that's normal. It's because they're getting older. They don't brush enough. Who knows? But let them know how that happened, why that happened, and to not brush so hard. Okay, so just kind of a little extra I'm going over, but every little bit helps, right? Let's go through one more here. A patient presents with a dental abscess and severe pain in their upper incisor. On examination, you find an infection in the center of the tooth. Which part of the tooth is affected and what treatment approach would you recommend? So kind of the same type of question. So look further into it. It's talking about a dental abscess and severe pain in the upper incisor. There's an infection in the center of the tooth. Where is this? Okay, so I'm just going to skip over and let's talk about the answer. This is the pulp again. Anytime there's a dental abscess, it has to do with the pulp. The pulp is affected. So even if you didn't read the whole question, maybe you just decide to not read the whole question. As soon as you saw a dental abscess, you know right away that's the pulp. You could even ignore the rest of the question. So the rationale says basically very similar to what the last pulp question says, that the pulp is the innermost area of the tooth. An abscess does cause severe pain, especially when infected. The recommended treatment would involve a root canal. So we talked about this already, but this is just a different question. So what did you guys think? How did you do? I hope you liked those questions. If you're in the VIP Board Exam Prep Academy, we go over mock exam questions every single week. And the course is learn at your own pace. So even if you sign up right now, you might be thinking, did I miss that mock exam class? Oh no, this sucks. Don't worry, it's learn at your own pace. You have all of these PowerPoints inside the course right now. You can jump right ahead and go through all the mock exam question PowerPoints if you want. There are also modules per week of different topics to learn, and I'm teaching classes pre-recorded. So you have heard me teach these classes. So if you don't want to read a PowerPoint or go through a textbook or anything, you just want to listen to me teach you, you have that option as well. So I hope you guys had fun with the tooth and tooth surfaces mock exam practice. I hope you did. And let me know if any other questions. There will be more mock exam practices coming up. I'm going to upload some more videos. So definitely subscribe to the YouTube channel if you haven't already, and click like if you want to see more of these videos. So thank you guys for watching, and I'll see you in the next one. So are you thinking about becoming a mobile dental hygienist, meaning you're not going to work for a dentist anymore? You're not going to purchase your own standalone like a physical location, but you're either going to see patients in your own home, I can see patients in mine,